Good afternoon, this is Mary Ann Snow, and I'm here today to talk about measuring and recording temperature. And we're going to start with using the oral temperature site first, and there are a couple different ways to do that. Basically, temperature is one of the very important vital signs that we take as nursing assistants, and it will help the nurses and the practitioners figure out if the person is responding correctly to medication, say antibiotics for an infection, or if they need something different, or if they have an elevated temperature, it will tell them that they may need to look for a problem. One thing I need you to understand, since nursing assistants work a great deal with an elderly population, is that an increase in temperature is not the only sign of infection. Many times an elderly person will respond to an infection by decreasing their temperature. Remember, their immune systems are a lot older than ours, and they can't mount a defense as well as you can when you're younger. And so fever, being a normal response to a problem, may not happen in an elderly person the same way that it does in someone younger. So, oral temperature site is probably one of the most basic places for us to measure temperature. And this used to be done primarily with a glass thermometer, and back in my day, that had real mercury inside it, and then they found out that that was so toxic that they had to stop putting that in thermometers. We thought it was pretty cool to play with when we broke the thermometers, but now what's inside a glass thermometer is an alcohol-based solution which responds to temperature. But glass thermometers are pretty rare in a clinical situation these days, so I'm not going to show those today. What I want to focus on is a digital thermometer and also an electronic thermometer. So digital and electronic, that seems like we are splitting hairs a little bit, and we are, because anything that is digital has an electronic readout. And these are battery operated. Some are disposable batteries and some are replaceable. These are very common, very easy to use. And you will see all of these types of equipment in the clinical area. Okay, let's talk about a number, a range here for a moment for oral temperatures. We have anywhere from, and it's very important that you know what these numbers are, because this is what you're going to use to report to your nurse. You measure, you get a number, and then you need to know what to do with that information. If it's within a normal range, you're going to record that appropriately, but if it is outside the normal range, then you must report that. And so it's very important that you know what to expect as your normal values. So 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit is your normal range for an oral temperature. On the Celsius scale, that is 36.5. Let me fix that real quickly. 36.5 degrees Celsius to 37.5. And of course, the unit of measure for temperature is either degrees Fahrenheit or degrees Celsius. depending on what is required in your recording system. Remember, every number has a unit. When you write those down, it's important to include that. So, know your normal ranges. All right. Now, there are several brands of equipment, manufacturers of equipment out there for oral thermometers, but I'm going to show you two very common ones. This is a very typical small digital thermometer. This one actually has a replaceable battery, so the thermometer itself is not disposable. You can replace the battery inside that. Some of these digitals are disposable. Once that battery wears out, it's finished and you get a new one. Now, this is a very simple operation. One button to push, you wait until it beeps, and then it has finished registering the temperature. However, in a clinical situation, this is used for many different people, person to person to person. And so we must keep the equipment clean and sanitized. And so we have a protective cover that we will use with the digital thermometer. And you can call that a sheath or even a condom. It is a thin plastic cover that goes over the part of the digital thermometer that is going to go inside the person's mouth. Okay? And this just takes a little practice to learn how to use these, but you follow the arrows on this piece of plastic and slide it down there. And don't poke a hole in it, because we all know how good condoms are with holes in it. Not very, right? So don't poke it in too far. Take off your paper backing, and then there is a plastic, a very small plastic covering on the digital thermometer. Okay? And then placement for this, for an oral temperature, placement in the person's mouth is very important. And many times you will see this done incorrectly. Incorrect positioning will not give you an accurate reading. If you want accuracy, you need to follow step by step and do it correctly to get an accurate reading. So the tip of the thermometer, where it's going to sense the person's temperature, needs to be in the back of the mouth by the molars. These go under the tongue, back by the molars in the bottom of the mouth. Under the tongue, back by the molars. If you place your thermometer in the person's mouth incorrectly, it will look like this. It's going to stick straight up behind their front teeth. That's not right, okay? It needs to be under the tongue, in the back. And make sure you take the sheath out when you take the thermometer out. So, correct placement. Place your thermometer and you'll get an accurate reading. Now, turn this on first before you put it in the person's mouth. Then you will get a screen reading that will tell you that it's ready. It will usually indicate low, L-O, on the screen. That does not mean that the battery is low. It has nothing to do with the battery. What that means is that the thermometer is reading the temperature of the air around it. And it knows that that temperature is too low to be the person's temperature. So, but that is what the ready screen will look like. So when you see that symbol on the thermometer, the LO, then you can place the thermometer in the person's mouth correctly. Ask them to close their lips, not to bite, close their lips and hold that in place until the thermometer beeps. And then you would remove that and take your reading. Okay? Now, an electronic thermometer looks someone like this. This is a specific brand. There are many, many different brands on the market, and it's also very important to follow your manufacturer directions for your equipment so that you know that you are using these correctly. These are also battery operated. These carry their covers, their probe covers. We call the part of the thermometer that we are going to place in the person's mouth is called a probe. And that is where the tip of that probe is where the heat sensitive part of the instrument is located. So the probe, removing the probe from the instrument is what turns it on and off. And then this particular brand has a little case on it so that it will carry the probe covers around with it in a box. Be careful how you open that box when you put a new supply box in, because if you open it correctly, then you will keep your covers clean and not accidentally have them falling all over the floor. So you put your probe inside the box, you pick up a cover. This is a little tricky to load. You need to hold it on the neck part of the probe, here on the neck, and not on the top piece, because this is the eject button. So if you're trying to load it and you can't, it's because you're telling it to eject at the same time. So you're going to put this in the box, push it into a probe cover, and then it's a little bit hard to see, but there's a button on top that will pop up that tells you that that probe cover is secured. And then you will place this in the person's mouth, and it will beep when it is finished. Now, there's a couple of things that you need to look at before you use these instruments. As I said, it's important to know how to use your equipment so that you get accurate results and you get what you need. So there are adjustments on here where you can change from Fahrenheit to Celsius. You can also change where you are using the instrument, because both these digital and electronic thermometers can be used at a different site. They can be used in several different places on the body. So you would need to adjust your instrument for the place you're reading the temperature from. Okay, and then some of these will store information from several different people, and then you can pull that information, you can pull that information up later and refer to it for recording. However, I do not like to do that because it does not store names. And while it will store a number of temperatures, I may not always be able to connect that number to the person that they came from. So I don't use that recall function. I will write down my measurement on my notepad before I record it. Okay. Now, when you boot this up, and remember we take the probe cover out to boot it up, it will give you a blank screen. It will have a blinking indicator to tell you which part of the body you are set for, and you can change that to wherever you need it to be. It will also tell you if your battery is charged or not, and it will tell you if you're reading in Fahrenheit or centigrade. So you check all of those settings. And then you need to get it loaded, get the probe cover loaded, and get it in the person's mouth relatively quickly, because this will time itself out if you don't have it in their mouth quickly enough to read. So this is electronic. This is digital. Both of these give you a digital readout. Both of them use batteries. So they are technically both electronic. Most of these are portable. And some of these, very similar to instruments like this electronic, are attached to the robots, to the vital sign robots. You will see instruments like this that have been integrated into the vital signs robot that has the blood pressure and also the oximeter attached to it. We'll talk about that more in another segment. Okay, so for the oral site, you can use either one of those instruments. You have your normal values in both Fahrenheit and centigrade. Now, there are a couple of very specific questions and considerations that you need to make in taking an oral temperature. I know you wouldn't think that this would be complicated, and it really isn't that complicated. However, there are some things that will change the accuracy of your recording if you're really not paying attention to them. So we want to make sure that you include these important points. And one is that you will ask the person if they have had anything hot or cold to eat or drink in the past 20 minutes, or if they have smoked, because that will affect the accuracy of your reading. It will change the temperature inside the mouth. Okay, have you had anything hot or cold to eat or drink in the last 20 minutes? Say within 20 minutes, or smoking within that time frame. Do they have any pain in their mouth? Are there any sores or pain that you need to be aware of that would make it difficult for them? What is the mental status of the person? Are they confused? Will they understand the directions you are asking them to follow? For a person who is really confused and may not know what this thermometer in their mouth is, they may try to bite it, and they could possibly hurt themselves doing that. So an oral temperature may not be the best choice for them. So if they are confused, you may need to think about another site. Sometimes with very young children also, an oral temperature is not appropriate because they won't necessarily hold it still long enough to get a good reading. Is the person on oxygen? And that may also affect the accuracy of their reading. Maybe the person, if they're using an oxygen mask that covers their nose and mouth, we would not necessarily want to take that off them. So we would need to use an alternative site for measuring temperature. Sometimes if it's just the nasal cannula in their nose for the oxygen, then this will probably not affect the temperature reading. Okay, but a mask would do that. All right, so very important considerations. Proper placement under the tongue, back by the molars. Now, a thermometer is your tool. So you need to know how to place it correctly. You need to know that it's working properly, and it's not the patient's job to tell you, does that feel like it's in the right place? You need to see where you're putting it. You need to ask them to open their mouth, lift up their tongue, place the thermometer correctly, and then ask them to close their lips and just hold still for a minute until it beeps. All right? You can't, it is not the person's job to put the probe in their mouth, and it is not their job to tell you that it feels like it's in the right place. You need to ensure that is correct, or you will not get an accurate reading. Now, Okay, and then what we want to do is make sure that we are following aseptic practices, and think about what you need to do when you are removing the thermometer. Do we need gloves for this task or not? So since saliva is considered one of the other potentially infectious materials, when we are handling anything that does come in contact with saliva, we should be thinking about whether we need gloves or not. Now, this electronic thermometer has its own probe cover, and it also has an eject button. And so we don't touch anything on this thermometer. We simply load the probe, place it in the person's mouth, and then when we're finished, we hit the eject button over a trash can, and we don't touch anything. Now, with the digital thermometer, we will have to touch something as we are removing the thermometer to read that. So we have the plastic sheath on the thermometer, and what we want to do is have our instrument ready. And then we're going to put, I'm very right-handed, so when I take this out of the person's mouth, I will be holding it in my right hand to read it and to dispose of the sheath. And so I need a glove on the hand that I'm going to use the hand that I'm going to use to take the cover off. That's where I want my glove. So I'm going to take this out of the mouth with my gloved hand. I'm going to take off the sheath, put that in the trash can, remove my glove, and then continue with recording the information, recording the temperature reading. Okay? So it's important to think about that. And then also, since this is community equipment and goes from room to room to room, it's a good idea to disinfect this with a disinfecting solution, to wipe this down, probably with more than just alcohol swabs, but to make sure occasionally that this does get cleaned. You can use alcohol swabs on this device if you feel that that's needed, but we have clean hands when we are using this equipment, so that should not be a major concern. We also want to think about not putting equipment all over the person's bed, since that is considered theirs, and so we don't want to be taking things from room to room to room, from one person's bed to another. So we would put down maybe a paper towel barrier on their bedside table or something like that for our equipment when we're not using it. Okay? So that pretty much sums up oral temperature. We use oral as basically the standard site for measuring temperatures. And so when we write this down, all we do is write down our numbers, degrees Fahrenheit, and we're finished. There are other sites on the body where we need to indicate specifically where those numbers are coming from. Okay? So that's it for oral. If you have any questions, please check in your textbook, check with your instructor, and practice with both of these instruments. Especially practice with loading the cover, the probe sheath on the digital instrument. Okay? Thanks. And I'll be back with another temperature site. So check that out. Bye.